9 spiritual care guidelines to help during a disaster. The first guideline: offer security. Traumatized survivors need assurance about their safety above all. They need to know they are out of harm's way and that you are a person with whom they can safely ventilate their feelings. First, simply say, "You are safe. Nothing can get to you here." Reinforce what you say with a relaxed posture, a welcoming smile, eye contact, touch, unless they shy away. Offer hospitality. Do you need anything? A drink of water, food, a blanket, depending upon the situation. The second point is listen. Listen with an attentive ear. Guide the conversation by asking, "What did you see and how did you feel?" when survivors don't seem to know what to talk about. Survivors need to begin to deal with their feelings and how they perceive their situations. Relax and let them wander verbally. The third point is be quiet. Allow survivors to take the lead in conversations. Do not interrupt. Ask questions only when they seem to want to talk. Their feelings are so intense, they may not know where to begin. Reflect what you are hearing in natural pauses. Keep a quiet, composed attitude. When they grow silent, ask a few open-ended questions or make supportive statements. Do not tell victims you know how they feel, because you do not. If they do not respond much, sit with them quietly until they are ready to speak again. Sometimes simply knowing someone is there is enough. The next point is support. You may hear things that shock you. Survivors may have feelings that cause them to say things that are violent in nature. They may curse or describe a desire to hurt someone. Do not confront, judge, or correct at this time. Say, "You sound really angry, upset, hurt. I think I would be too." Survivors may show anger and anxiety to cover up their fears, their feelings of vulnerability. Do not take their anger personally. They are just scared of being hurt again. Let survivors know you are on their side. Stay theologically neutral. Survivors may try to explain things in ways that contradict your theology, your faith, your religion, your understanding of God. Although you may be used to discussing theology with people and faith and religion with people, and attempting to teach people within your faith traditions about your doctrine, do not preach at this time. Rather, let survivors preach to you. Affirm them. That's a comforting thought. Avoid trying to answer questions like, "How could God let something like this happen?" Attempts to explain God's will or the human condition could anger or confuse them rather than help. Say, "I don't know, but what I do know is that God is with us now." Use prayer and scripture guardedly. Unless you are sure of a disaster survivor's religious position on certain issues, stay neutral. For instance, Father is a Judeo-Christian image of God. And even in this day, many Christians find it a troubling image. There are other images in other faith traditions. However meaningful something is to you, it may not be meaningful to the survivor. So therefore, avoid using theological concepts when you don't know to what faith tradition or understanding the survivor subscribes to. Wait for survivors to ask for some scripture reading or spiritual reading or something about God before you offer. If they do not have a preference, offer something that is affirming. Service or serve. Practice hospitality. Attend not only to survivors' words, but to their needs. Offer to get them a drink. Ask if they've eaten recently and if they could care to go get some food if they have not. Ask if they are comfortable. Avoid offering what you cannot deliver. Avoid fixing things. While you can serve disaster survivors, you cannot fix things for them. You can only assist them. You cannot assess damage and clean their house, but you can offer to go to the house with them. You cannot make funeral arrangements, but you can help them find the phone book and sit with them while they make the call. You cannot promise their child will be found alive, but you can stay with them while they wait for news. The eighth point is pray for them. Depending on the situation, this may be only a silent prayer which you offer internally as you sit with them, as you leave them, or even sometime in the day when you think of them. Prayer should never be forced. When the survivors come, you may say something like, "I'll keep you in my prayers." If they respond positively in some way, such as thanking you, ask if they would like you to pray with them at that moment. Having spoken with them and listened to their concerns, you will know what is on their heart and mind. Pray for those needs and things which will increase their comfort and healing. For example, if they have spoken of anxiety, pray for God's presence and comfort for them in these anxious moments. On the other hand, if they have expressed anger at workers or at anything, however valid you may feel their anger is, avoid praying for the persons who have angered them. Focus on the present. The ninth and the last point is focus on the survivor's needs, not your needs. In a sense, you will also be a disaster survivor. You will find that you have your own needs. You should have an opportunity to deal with them at a later time. Continually gauge your ministry, your work, by asking yourself the question, whose needs am I dealing with? Am I dealing with my needs? Or am I dealing with a survivor who is sitting with me, who is talking to me, that person's needs? This is the best way to assure you are staying focused on the survivor and not yourself.